I'm Dr. Mitch Katz, and I'm the director of the health agency. I want to thank you all for coming. Thank you, and also a special hi to all the people in our virtual world out there, with special attention to some of the great sites where I've had a privilege of being a doctor. My clinic, Roybal, out there is one of our sites. Thank you. I've worked on the medicine service at Olive, which is one of our centers, the medical service at Harbor, which is out there, and the medical service at LACUSC and Rancho, I promise, right? And that will be next year. I do 2 years on each of the other medical services. So I'm so proud that we are an agency filled with so many great people, so many centers, so many programs. I want to hit on two themes that are particularly important to me. The first one is how much we can get done because these three great departments have come together. And the integration has always been about using the strengths of the three departments to tackle the really tough issues that make it hard for people to live the healthiest life in their community that they can. So think about two examples. One, which are people who have been incarcerated who are incompetent to stand trial. They languish in jail because they can't be before a judge, right? We are a country where you're innocent until proven guilty. We are a country where everybody has a right to go before the judge. Well, it turns out if you can't understand right and wrong or the judge's role because you're trapped in a psychosis, you just languish in jail. And jail is not a place where it's easy for people to reach competency. It's an incredibly stressful environment where even the strongest person could easily break. And so now working with DMH, especially on finding the appropriate mental health treatment, but also with DPH, because many of these people need substance treatment. West Ford is here and has helped arrange it. We now have 60 people who were once in jail in this category, all receiving mental health treatment so that they can reach competency, they can have their day in court, they can move beyond that experience. And we will hold onto them. We will continue to house them beyond any court date. And this is a group where prior to the coming together of the agency, these people are not new, they've always existed, but they were languishing in jail. And on the public health side, I've been really pleased, and it was nice to see it was completely organic how with the Zika virus, the connection between the Department of Public Health, which takes the lead around disease control and infectious agents, learns about this, has a phenomenal public health lab, which is often at the leading edge of figuring out what are the best tests, working with our clinicians, because the clinicians at our hospitals, we take care of a very large immigrant population, group of people who are going back and forth between here, South America. They're not sure what testing they should do, right? How great that this was set up, and I have to say, you know, this was set up completely at the line level. That is to say, it wasn't, nobody at leadership said to the clinicians and the public health investigators, you should do this. They called each other. Now in the context of the agency, they set up an e-consult, which is now our electronic way of doing it. So, you know, I'm incredibly excited to tackle together with the other leaders of these departments, homelessness, our substance addictions, the tragedy of children trapped in foster homes where they're not getting all the services they need, right? There's so much we can do together. The other big theme I want to hit on, and you've already heard from two of our labor leaders, and you're going to hear from more, is how much can be done working in partnership with our labor leaders. So all over the country, public systems like ours are getting smaller, they're closing, right? There was a day in California where there were 48 counties with public hospitals, right? Now, you know, we're down to, I think it's less than 10 that still have county hospitals, right? So if we're going to not only preserve our system, but we're going to grow our system, we're going to show that the public system, the public mental health system, the public health system, the public DHS system, we can do a great job. We have tremendous people. Look at all of you. Look at all the people on the screen out there. People who have dedicated their lives to want to take care of people. We have so many assets. There's no reason why we cannot provide care at the same or better level than private systems. But to do that, we have to be working together, and that's what's happened, you know, starting with my colleague Bob Schoonover at SEIU President, who I think was the first to recognize, God, we could get so much done together if we just aligned, recognizing our common purpose. And I see that now we're at the stage with these other great labor leaders where we're all saying together, hey, this is the right model. We all understand there's a contract process that needs to be respected. There's labor negotiations around salaries. But what's our greatest joint goal? To prove that the public system is a great system and should survive and thrive and should grow and not diminish the way it has in other places. So I'm particularly grateful to the other labor leaders here. Thank you.